we're talking health on the show this afternoon.
Healthy Habits
On Afternoons with Helen Farmer.
You have probably heard the term scoliosis, but we're unpacking that condition today, and we're going to be speaking to two patients. And joining us live in the studio is Dr. Antony Michael, consultant orthopaedic spine surgeon at the Neuro Spinal Hospital. So thank you for being with us, Doctor. I'm intrigued why you were drawn to this area of medicine, actually. What is it about spines that you find so fascinating?
So thanks for having me.
You're very welcome.
It is probably one of the most difficult aspects of spine surgery. Now, I don't know if that is what drew me to it, but after medical school, I wanted to become actually a neurosurgeon. So I worked with a neurosurgeon for about a year and a half and subsequently went into orthopedics. The carpentry part of that really appealed to me.
Carpentry.
So I then focused on becoming an orthopedic surgeon, completed my orthopedic training in India, went to the UK, completed my training in the UK. And during that part, we have postings in the spine department and scoliosis. And it was the most challenging sort of procedure that I've seen. And I was like, right, I want to be doing this. I want to become good at it. Mm-hmm. So since then, I've just been specializing in spine surgery in general, but my interest is pediatric spines and scoliosis. Can
you explain in simple, non-doctorly terms for me what scoliosis is? What happens in the body or could be happening and when it happens as well, Doctor?
Okay, so scoliosis is not a single condition. There are different types. The most common is what we call the adolescent idiopathic scoliosis. And what that means is that a spine that was normally straight, so you were born straight, you grew up first, X number of years of your life with a straight spine. And usually when you go into the rapid growth spurt, something goes wrong. And there's a lot of theories. There are some genetic findings. The spine grows sideways. And again, most commonly in the top half of the spine that we call the thoracic spine. Mm-hmm. And when it grows sideways, there's always also a twist in the spine. So that makes the shoulder blade, usually on the right side and the back, stick out.
Okay, so you've got that kind of misalignment.
Exactly.
Okay.
And there is, again, a huge spectrum. So it can curve like 10, 15 degrees and then stop, or it could continue progressing. And I think the most severe adolescent curve that I've had to do surgery was around 95 degrees.
Oh, gosh.
Which, is difficult.
The quality of life there for a young person, and what I don't want to hear too much about what happens in surgery, but what kind of results can you achieve?
So again, depending on how flexible the curve is, we can either get it almost completely straight or at least get 50% correction. But the key is that you stop the curve getting worse. And if it gets more than 90 degrees, then it starts affecting your heart and lung function. Yeah,
you've got those organs to think about. What about non-surgical approaches? Anything that's been useful or any interesting developments in your career that you think are worth sharing?
Yeah, so again, we're just talking about the very common adolescent idiopathic scoliosis. We do have early onset, congenital and things. So in the adolescent group, and this is why I'm very passionate about appearing on media and promoting...
raising awareness.
Awareness, exactly. Is that if we can diagnose it early, say less than 40 degrees of a curve in a young growing child, we have special physiotherapy and bracing, which is like a corset technique. And in combination, the success rate is over 70% in either improving the curve or stopping it from getting worse.
So as parents, what should we be looking for in our children's posture, movement, appearance?
Yeah, so children's posture is becoming a subject of great importance now, especially with COVID, homeschooling, sort of more easy availability of all these digital media.
Yeah, we've all got
tablets.
Tech neck right now, Michael.
Exactly. So I think the first thing is awareness. Once you're aware of it, you can have a regular check of your child's back and trunk.
What would that involve? I think that's often a bit of a scary idea as, we need to go and see a doctor. Oh my goodness, we're going to see a spinal surgeon. And, of course, your heart rate starts to spike. What would an exam kind of look like?
Yeah, so very simply, if someone comes to see me, I get a brief history. How was the birth? How was the development? When did anyone notice anything of concern? And it's usually two aspects to it. One is to try and identify if there's a scoliosis, how severe it is. And the second thing is this an idiopathic scoliosis or is there some underlying reason, such as a tumor, for example, causing it? So recently I had a patient who was 10. He was brought to me. He was a completely normal boy, but his grandmother, mother, and sibling have scoliosis.
So they were preempting.
That was the height of awareness. I was very impressed.
We're lucky enough to have joining us in the studio consultant orthopaedic spine surgeon, Dr. Antony Michael. He is based at the Neuro Spinal Hospital. And we've got two of his patients with us as well, who I'd like to say glided into the studio. There were no wheelchairs or Zimmer frames or braces. So, Doctor, you've clearly done a good job with these two. Joseph, we'll start with you. You are working in the physical world. You're a physical, transformational trainer. You work with rehab and helping people get to their best selves. But you've had a bit of a transformation yourself. Tell us about the back pain you were suffering and what led you to go and see Dr. Michael.
Yeah, so 2 years, I think it's 2 years now, horse riding and collapsed disc, basically a herniated disc. So it wasn't really aware of what I'd actually done. So I incurred lots of physical pain down my leg, in my back, and it was pretty bad. It was just after the lockdown had finished, and I saw lots of physiotherapists, and then fortunately I was lucky enough to be connected with Dr. Michael. And he took one look at me. He tried a few techniques to avoid surgery because obviously I didn't want to be in the hospitals for a prolonged amount of time. And we went ahead with the surgery and never looked back. Amazing. Yeah.
I think for lots of people, and this isn't away from spine health, it's everything, kind of seeking a diagnosis and putting your hands in someone you trust, that's a really scary process because you can be searching for answers and searching for a plan. And actually it's a huge relief when you understand what it is and what can be done about it. And how have you been since? What was the recovery like? Because you, being a physical person, that must have been a bit of an identity shock to be laid up for a while.
Yeah, of course. So there was a small chance of not being able to walk.
Oh my gosh.
It was a bit scary considering my career and whatnot. But thankfully, I was in the right hands. Honestly, I can say Dr. Michael's sort of patient care. I've had similar surgeries in the UK before, but his patient care gave me enough confidence to. He was avoiding the surgery as much as possible.
That's really nice to hear because it is a common. I don't want to say complaint. It's a common comment we have. People being very, knife happy.
Yeah, invasive. Yeah, he was very reluctant to go ahead with the surgery unless it was. Absolutely imminent. We had to go ahead and do it. So I was very lucky in that sense.
Dr. Michael, tell us a little bit about that decision.
Yeah, so it's a clinical philosophy. So I always say to my patients, I will give you the advice that I'd give to my family. And so it just means that you treat somebody to the best of your ability without any other confounding factors. And that has really helped me throughout my career, I think, and the patients appreciate that. So you can't
hope for more. You really can't. I think as an oath that you would take, obviously you have your medical oath, but I think as a kind of a bit of a moral compass, I think that's what every patient and their family would want to hear, especially, with patients as young as the couple we have in the studio. Mansfini, you were just 19 when you had surgery. We were talking earlier about, I'm going to let you pronounce it, AIS, adolescent idiopathic scoliosis.
Yes,
Can
absolutely.
I be your
you got
assistant
it right.
nurse? Yes. Tell us a little bit about some of the symptoms or things that you'd noticed or your family noticed that led you to go and seek that diagnosis.
Sure. So I think the first time that I had even noticed that there was something wrong was I just kept having this kind of nagging pain in my back, and it was confusing because it was definitely very muscle related at the time. So I, didn't even know what scoliosis was at that age. And I think following that was my mom kind of saw some sort of a curve in my back, and she was confused as well because she was like, this is abnormal. So that was kind of the first time that I had noticed anything, and that pain didn't stop because at the time my curve wasn't big enough, I guess, to be considered for surgery. And so it was kind of put on hold, and we were hoping that it would just kind of stay stagnant or, go back to normal as much as possible. But that pain kept going, and it was just kind of interfering almost with a lot of what I was doing, because at the time I was playing sports and things like that. So it just kept getting worse. And so that's kind of when I consulted with Dr. Michael, and he definitely helped change that perspective, because at the time we were under the impression that there really wasn't anything to do other than medication.
So when it comes to making a call of saying, okay, now is the right time to do surgery, the angle is severe enough, we know that we can prevent further curvature, how important is that timing?
It is very important, because you have to strike the right balance between being, as you say, knife happy and waiting too long, which makes the outcome suboptimal. Now, there are international standards. I'm in the British Scoliosis Society. So we know from a lot of research that's been done in the past that if curves are more than 50 degrees, they continue to progress even after you stop growing. And, in your 50s, 60s, you get to a stage again, which can affect your heart and lung function. So that decision is fairly straightforward. But unfortunately, again, due to the lack of awareness, I've seen patients coming for the first time with a 70-degree curve, which makes surgical outcome suboptimal.
We've just had a message here saying, it's great to hear Dr. Michael. I just visited him yesterday. That's why we get to buy his most in-demand doctors in the studio. Can I ask you, Antony, a little bit about what your prognosis is like and what your recovery's been like? You're just 20. So, the thought of having surgery and that being something that could have affected your way of life and quality of life must have been really scary. What's it like on the other side?
Yeah, surprisingly enough, I wasn't as scared about the surgery going into it, at least. But then obviously recovery's been quite a battle because, it's one thing to know that there's definitely a change that automatically comes after surgery. But then, kind of adjusting to that and making sure that you're okay while also being able to carry out everything that you want to do. That was a bit of a struggle at first, because finding that balance was pretty hard for me as I was still in college. So, attending classes with, whatever hectic schedule I had with the recovery was quite the hassle, I would say. And so I think as I got used to it, it definitely got better, but it's definitely not an easy process whatsoever. And, it's something that it definitely helps to have really good support and to be in good hands, so that any questions that I had, Dr. Michael was always there to answer them. And so, yeah, recovery is definitely
a process.
Quite a process.
And any pain now?
Here and there, yes, definitely some moderate pain, but, I still have about 6 months to go for the entirety of my recovery. So I'm going to hope that it goes down by that point.
And this is where it becomes a collaborative approach, I guess. You've done your bit, Dr. Michael, you've had that surgery, and now it's up to patients to, and this is where I kind of fall down. I'm like, okay, I've had my knee up, so now I've got to do all the rehab myself, and I've got to do 45 minutes of exercises, and yeah. But it's so great to hear that you're there as well.
Yeah. So, this is something that was very interesting in my conversations with Joe here, because he's been very proactive, and I've almost had to hold him back. But I think we've struck the right balance, because he's still, at his best, I think. And we've had conversations about optimizing recovery. And this is a very, very important part of the process. And as Manaswini, she's also been a very motivated patient.
You've got some good students.
And majority of my patients, I'd like to think, are like that. But it helps a lot if someone is really willing to work hard, and then I can point them in the right direction and say, this is what you can do. Even last week, I've given Joe's number to a patient. I don't know if they've contacted.
See, there you go. Collaboration.
Very kind.
Good. Well, guys, thank you. You're very kind for giving up your time to come. And as I said earlier, that raising awareness piece, Dr. Michael, I think is so, so important. We have had a message here saying someone's already been to see you just yesterday. But if anyone does want to seek your help, your consultation, maybe an expert second opinion, as we said, you can find Dr. Antony Michael there at the Neuro Spinal Hospital, where he's consultant orthopaedic spine surgeon. Guys, thank you both. And of course, Dr. Michael, for your time. Really do appreciate it. And,
thank you very much.
If you've got any questions or you want his details, drop me a little line on 4001. I'd be very happy to connect you.
Healthy habits
On our